Alberta's government has announced some big changes to the province's healthcare system. Premier Danielle Smith says she's not satisfied with the current structure. Smith, along with several cabinet ministers, laid out the health reorganization plan today. Here's some of what she had to say.
Starting today, we're creating an integrated provincial healthcare delivery system that concentrates on 4 priority areas: primary care, acute care, continuing care, and mental health and addiction. We believe that by creating specialized organizations within one provincial system, we will enable each organization to look after one area of healthcare only and avoid the scattered and uncoordinated approach of the more rigid, centralized structure that exists now.
For more on this story, we've reached the CBC's Terry Reith live from Edmonton. So, Terry, what does all of this mean for patients?
Well, Andrew, in the very short term, it really doesn't mean a whole lot. And let me talk to you a bit about the situation in Alberta right now, a fast-growing province, 4.7 million people. But if you want to get into a hospital this morning in Calgary or Edmonton, you are looking at a 1.5 to 3.7 hour wait. If you want to get a family doctor, good luck with that. So the Danielle Smith government has really blamed Alberta Health Services for creating this situation, thus the changes that are coming through. So here's the aspirational part. Here is what they are hoping to do with these changes. So, for example, with primary care, that's your family doctor. So they want everybody in the province to have access to primary care. But that's not going to necessarily mean a family doctor. You could be talking to a pharmacist or to a nurse practitioner. One of the big changes is in the approach to mental health and addictions. Now, this is a real big hot button issue in Alberta right now. And so they are setting up an entirely different department for mental health and addictions. It's going to be under a separate ministry. The hope is that through getting people healthier and dealing with addiction separately, they won't wind up in the emergency room. Same with primary care. By keeping people healthy in the short term, it'll keep them out of the emergency room. So that's really what they're trying to do here with these changes.
So Terry, tell us more about what's driving this change right now.
Well, I did mention, Andrew, that the Smith government really blames AHS for a lot of the situations in healthcare right now. So in a way, this is Alberta Health Services, the big super board that was created in 2008, getting its wings clipped. Will that work? Well, we spoke with Dr. Tom Noseworthy. He's a guy who's been around Alberta for a long time, former president of the Royal Alexandra Hospital in Edmonton, and now a professor emeritus in health policy at the University of Calgary. Here's what
I think that this is pretty shallow way of basically undermining the AHS that now exists. It has made steady progress towards better integration. And now we believe, or are expected to believe, that 4 separate organizations with separate boards of governance is going to be more integrated? I don't think so.
So, Andrew, over the next year, these changes will come into place. As the pundits like to say, the proof is in the pudding and the devil is in the details, and we will be waiting for those.
Terry, thank you. The CBC's Terry Reith live in Edmonton.